Issues involving health, education, and external pressures are negatively affecting our younger generations. My name is Anya Parasher. I'm a high school student and an advocate for mental health. Join me as I explore and learn about these issues and their possible solutions with various experts and leaders around the country. This podcast is affiliated with Project ECHO, Extension for Community Health Outcomes, a worldwide nonprofit organization that spreads critical and life-saving knowledge to various communities across the globe. Welcome and thank you for joining us. Welcome to the third segment of the LIFTER podcast. My name is Anya Parasher, and I'm super excited to have this guest on for Mental Health Awareness Month. Today's guest is Dr. Kristina Sowar. She is the Associate Professor of Child and Adolescent Psychiatry at the University of New Mexico. Today, we talk about eating disorders, mental health in teens, and what New Mexico struggles with when it comes to teen depression. Stay tuned, and I hope you enjoy. So I just want to start off by talking a little bit about when you first took interest in psychiatry, and what was the thing that most compelled you about the subject?
Thank you for asking. It's been a journey, and I think in psychiatry, when you're in medicine or entering medicine, whether it's medical school or another form of medical training, you have all these options, and I think weighing out like, where is the space that fits me best? What do I really enjoy doing? How do I like working with people? Psychiatry was a space for me that felt very much like definitely an attraction of the work in connecting with people at deeper levels psychologically. I'd always been interested in psychology and just understanding like the mind-body connection and, what really drives people and their emotions and behaviors. So psychiatry was a good fit in that regard. And I think it's a nice opportunity for us to, connect with people on things like trauma and, childhood experiences that were painful, how they feel about themselves, the stories that they tell themselves. And so it's different than some other forms of medicine where we can focus a lot on like numbers and quantifiable facts and things like that. Psychiatry is a little bit more of a gray zone, but I think many of us that do it enjoy that and like the opportunity to, get to know people at some of those psychological spaces.
Yeah, you talk about those like childhood experiences, and now as a child and adolescent psychiatrist, what do you think is the issue that affects teens the most right now?
That's a great question. And I will speak from my role professionally, but certainly I recognize that, many teenagers or young adults could also definitely reflect well on this. There have been publications released this year, literature from research, that there is such a high number of young people, especially females, but across the board, struggling with depression and low self-esteem or low self-worth and anxiety, and kind of how that interplays with things like self-harm and suicidal thoughts. So, those are several issues, but I think at core of a lot of those is this sense of like low self-worth and maybe not having the strongest coping skills for the stress that we experience in today's society. Those are tough, and I think really make it, difficult for people to, navigate the challenges of just growing up and being a teenager, social development. When you're coming from a place that you don't feel great about yourself, that certainly makes it harder, and people don't always know where to turn in that situation.
Yeah, and I wonder, for me right now, I'm a high schooler, and COVID was a big part of that because we were on social media so much. And I think, for a lot of people, a lot of my friends, that was a huge factor, was just when you're seeing these videos of other people, it's really hard not to let that influence you as well. But, yeah, and I think especially you specialize in eating disorders, if that's correct. I think I read that. Um, how prevalent are eating disorders among teens, and what treatments can be done to help those patients?
Eating disorders are fairly prevalent in teenagers, and the incidence or the number of people that developed eating disorders also really spiked during COVID, like you're saying, with often more isolation and people struggling more, that eating or not eating was one thing that people had semblance of control over than other spaces. But yeah, the data are that somewhere around 10% of the US population, so that's like 30 million people, will at some point develop an eating disorder.
Wow.
The most common age range that we see people develop eating disorders is during the teenage years. And it's not just in the US, it's also globally in kind of countries of all sorts of socioeconomic standing. So we see some of the influences to people developing eating disorders that come from things like social media and just, other kind of societal influences that are becoming more widespread with internet and phones. So in terms of treatments, the kind of cornerstone, the foundational treatments for eating disorders are therapy and then nutritional support. So a lot of it is really kind of helping people understand why they've developed this pattern of coping, why they're kind of treating their bodies as they are, or, changing their eating. And then the nutritional piece, often to help them understand, like, really, this is what your body needs. This is what you need to be nourished, kind of helping with that piece. There's also medical care that's certainly critical to make sure people are healthy. And then from a psychiatric angle, we can help with medications, but often the therapy nutrition mix is the most important.
Yeah. I think it's really important too, because one of the things that I've noticed a lot is that we do focus and we talk a lot in school about depression and anxiety and some of the consequences of that. But one thing that I think is more normalized now because of the social media and stuff is eating disorders and eating habits. And so that's one thing that I've noticed personally, is that especially like being home and watching videos, it's really an individualized thing. So it's very hard to know when something is wrong. I wanted to shift gears and talk a little bit about New Mexico in specific. New Mexico's teen suicide rate has fluctuated in recent years, but in general, it remains pretty high compared to other states in the United States. What does New Mexico need to do in specific to help our teens more?
Yes, that's a really important question for those of us here, and just thinking about how we strengthen our communities and our families. So there are established risk factors for suicide that we can think about on an individual and a population level. For example, if people have a history of trauma at any age, but especially early childhood trauma, that's a risk factor. If people have other mental health conditions like depression, anxiety, bipolar, eating disorders, if they have, family history of suicide, if there are other things like high anxiety levels or high shame, for example, all of those can be strong influences. And so in New Mexico, we know that a lot of the people that live here, as compared with other states, have had adverse childhood experiences, early childhood trauma, more people that may have lived in poverty or have been exposed to substance use when they were young. And so in general, sort of the higher cumulative rate of experienced trauma or exposure to trauma that a lot of young people have, coupled with the fact that, many teenagers may have family members who have also experienced mental health issues, and then growing up in a society and at this time where, as we mentioned, there's a lot of pressure socially, including from things like social media, that is part of what we understand to be, where the risk factors are higher, or why we have a higher suicide rate in New Mexico. And then unfortunately, we also have less resources for care available. So, it's harder to get into counseling or to get mental health support. than in some other states. We just don't have as many mental health professionals. So definitely some pieces that can be good targets in terms of how we improve suicide awareness and reduction of the rates, but also, concerning in terms of what some of the people in our state have experienced.
Yeah, and to add to that previous question, I think mental health has been a very stigmatized issue. So it's often hard for people to get the help that they need. What steps should kids take if they aren't feeling well mentally, but they feel like they can't really reach out to their parents or get help from people at school?
This is a really important question. I'm glad that you raised it, because it is pretty common that people won't, especially teenagers, won't necessarily feel like they have a great outlet. Although it's been hopefully more normalized that, people struggle with mental health concerns, I think there is still stigma and anxiety for people about bringing it up. And so a few thoughts are that, a trusted adult, right? So if maybe you don't feel comfortable talking with your parents, but you do have a grandparent or an aunt or a coach, someone that you feel like is connected, that can be a good person to turn to. There are some crisis lines that are available online. There are some kind of teen specific ones. And then we have the 988 hotline now in New Mexico. So that can be a good place for people to, feel like they can reach out if they're in need. And then I think the other piece is that we worry sometimes that, we're exposing ourselves if we ask for help, whether it's in our family or with our friends. But, I do think sometimes we can also be the trend setters, right? So if we're open to disclosing to a friend or sharing with a friend that we need some support or some help, and see if they can also help with, anchoring you into an adult, that might feel kind of vulnerable or embarrassing at the start, but the goal, especially getting you help, is that also may help other people feel like they can, be open and share. So those are a few thoughts for resources.
Yeah, I'm interested about the hotline because I know that recently, I think last year, there were a few people who tried the hotline and it was like very successful, or some people felt like it wasn't like secure. Do you think that helpline is going to be impactful in, at least here in New Mexico?
Yes, it is. The helplines, the hotlines are, the experience can vary according to kind of what someone's, I think, seeking out of it. But the numbers suggest that with the hotline, we are seeing quite a few more people who are coming into, whether it's emergency settings or who are getting referred into counseling. So hopefully just that initial lifeline, that when people are in a state that otherwise they might make more self-destructive decisions, reaching out, is getting them more help. So the trend thus far looks promising.
That's awesome. I want to look into that more, but I want to ask, kind of, this shifts gears a little bit, but what are the challenges that you face as a psychiatrist, and can it be a mentally tolling job for yourself as well?
Yes. Yeah, being a psychiatrist is, I think it's really meaningful, and I enjoy it. I think a lot of my colleagues do too. And it's becoming a more competitive specialty in terms of when people go into medical school and choose their field of training. But there are challenges, definitely. I think there are shared challenges with other medical professionals, like other, physicians or other providers, just that we generally go into medicine because we really want to help people and take care of them, but we're in these big systems and working with insurance companies and, the other challenges that you feel like it's sometimes hard to really connect with a patient when there's all these other layers of stuff that you kind of have to do as a physician. But, beyond that, in terms of being a psychiatrist, like we mentioned, I think there's so much like connection in working with people and getting a sense of what's going on for them at deeper levels psychologically. But there can also be an experience of, experiencing of what we call like secondary trauma, or when you're listening to other people and spending a lot of time with people that are really struggling and have been through trauma, that, you can buffer to some extent, but also just absorbing that. And so it's a specialty that we talk a lot about, kind of people having their own ability to process and having space with that. And I think it's also hard when you see that they're, for example, as mentioned in New Mexico, when you're short on resources and you feel like someone really needs either more therapy or they need kind of other social supports, that housing, like just basic social supports that aren't available, that can feel sometimes pretty challenging, and some people feel demoralized with that. So it's I think all just kind of being able to accept some of the limitations, and then, dive in where you feel like it's important with patients.
Yeah, I was actually going to bring this up earlier, because it is Mental Health Awareness Month, and also because at least at Project Echo, we're trying our best to make sure that our healthcare providers and everyone who is working in the fields are being supported. I think it's just really important to kind of check in and see the flip side of that too, because it is a hard job. And, I think another thing that you brought up as well is the intersectionality between, like, it's not just mental health, but there are other social issues that go on. And that is and adversities that are really affecting our teens nowadays. My last question, I ask this to every time I have someone on. What advice do you have for younger people who want to address the issues of mental health, but on a societal level?
I would say thank you for your, enthusiasm. I mean, certainly we need more people as a nation, as a world, but, people that are really motivated about taking care of each other, taking care of our communities, and thinking about mental health. So hopefully find the foundation that gives you the energy to move forward with it. I think there are a few things, right? There's mental health is fairly broad. And so for some people, there are elements of it that speak more to them, right? Like if someone's struggling with substance use, or if they're struggling with depression or an anxiety disorder, whatever it is, that sometimes, finding like the niche or the area that you're most passionate about can be a good place to focus on. But, definitely there are some great organizations. I think that can be a really good place to get connected. Change starts small, like we talk about, right? So even if you're not in the space that you're quite able to like volunteer or get connected with an organization, even just like within your community of circle, whether it's friends or family, like sometimes opening up conversations about mental health, since it's not always something that people are comfortable talking about, or trying to reach out if you know that someone's struggling. I think all of those can be meaningful contributions. And I think for people that decide that like this is really a passion for me and I want to push it more to bigger picture societal level considerations, that learning about maybe some of the professions where that's possible, whether it's a psychiatrist or a therapist or an epidemiologist or a politician, right? Like there's so many different ways you can go about it. But again, just hopefully staying in touch with that passion for making that a priority is a good key to start.
Thank you so much for listening to the LIFTER podcast with Project Echo. Stay safe, and we'll see you next time.